So when I started my training, there were no hour restrictions for residents. So for the ACGME, they considered us to be students. So labor laws didn't apply. So when I started, it would be regularly you'd be working 100 to 130 hours a week. You
That's
had
crazy, yeah.
no set day off. And then starting in 2003, there were some work regulation hours that started. So the maximum number of hours now is 80 hours a week, which is still pretty challenging if you've got.
That's still a lot, yeah. If you're so you were pregnant during that. Were you still were you still working that many hours? Were there any other women in your residency program?
2 years below me, there was one other resident, but she was not married. She didn't have kids at the time. So.
And that's for any doctor, right? You don't have to be a plastic, like all doctors go that route.
Right. They go through some training. I mean,
Yeah.
it could be a medicine residency, might be 3 years, but the work hour restrictions are 80 hours. So be it a surgical specialty, a medicine specialty, but that's kind of your reported hours. And so if you think about it, when we were coming through training, that change of mentality of you got to go home versus, what do you mean you're going home? You got to continue to care for the patient. I think even me going through during my training, that change, I kind of looked down on that going home too early thing.
And so was your husband in the same program?
He was. So I met him in general surgery residency, and then he was 2 years ahead of me. So he finished his fellowship and went into private practice for 2 years, and then I finished my fellowship, and then we moved to Charlotte.